Recovering from coronary heart disease, or CHD. Heart surgery or a serious event such as a heart attack can be traumatic for the person and their family. There are processes in place that can help a person transition back into living a normal life. The cardiac rehabilitation programs. A trained healthcare professional may visit a patient before they have their surgery, where they will provide information about the condition and the actual surgical procedure. Once a person has had their operation and has been discharged from the hospital, their care would usually continue at home. Often, a member of the cardiac rehabilitation team will either call or visit a person at home to see how they are coping and also to review their progress. The cardiac rehabilitation programs vary between different hospitals, but they may generally cover the 4 key areas below. 1. An exercise plan. 2. An education program. 3. Guidance and strategies on how to relax. 4. Providing emotional support. Once the patient has completed the rehabilitation program, it is important to continue with what was learned. It is known that an improved diet and continued regular exercise make it less likely for future disease complications. Taking care of yourself. Future genetics are driven by carrying out clinical trials and research studies that focus on empowering patients and their families. That empowerment also includes providing education that can help us all potentially live better and healthier lives. On that note, it is important to understand the reality that management of our health is driven by a large extent on our lifestyle choices. Therefore, it is important that a person empowers themselves to live fulfilling lives. Part of recovering from a heart surgery is to move forward, but trying to stay fit and stay well in mind and body. The good news is that you are not alone in your efforts to live well after surgery. Your GP can give you advice around support that is open to you. There are also a number of charities that provide excellent support and community, such as the British Heart Foundation. Engaging with support groups. There is a saying that a problem shared is a problem halved. People that have heart conditions or their carers can join support groups that consist of others in similar situations, as well as trained specialists that can provide support. As I just mentioned in the last section, your GP can point you to groups in your area. There are also charity organisations that can help.